Fine day to everyone. Welcome to a new ALS workshop, I call it. Sometimes we call it the Expert Talk Series. And today we have all of you as our experts, plus we have experts. So I just want each of you to know that what you bring every 2 weeks to this program is extremely vital. You're very important, and you all have a little piece to the puzzle. So today, we have some honored guests that I would like for James to introduce to us. Thank you so much, James.
We do. And before we do that, I'm going to turn it over to Mira. I believe I want to make an announcement about the speech study, if I'm not mistaken. And
I had just readmitted her because she had cut out, I think.
No worries. I'll say the announcement about the speech study. So just so everybody who is maybe new to the speech study or has done it before, we have revamped it just a teeny tiny bit. As a reminder, we are now only requiring participants to record one session once a month for 5 months. We were asking for once a week for an entire year, but we've kind of reevaluated it so our scientists could have a little bit more long-term data. And I think it's a little bit easier to do once a month for 5 months. So if you could stick with that, we'd really appreciate it, regardless of if you feel you're not hitting the pronunciations of words correctly. That's completely okay. We'll take all the data we can get, and we just appreciate any time you give to that speech study as well. Seriously, from the bottom of our hearts, we really do appreciate it. I believe that was going to be the announcement for the speech study. Just a quick little update. Indu has put in the link for it in the chat if you need to register or access the portal. And with that being said, I will now introduce our speakers of the evening. We've got more than one, so I'm going to read some biographies. Starting in 2019, after being diagnosed with ALS, Brian Wallach launched I AM ALS, a patient-centric, patient-led nonprofit dedicated to rewriting the ALS story, which has grown to a community of over 50,000. Brook Croke is a genetic counselor at Synapticure, where she provides genetic counseling to individuals across the United States with ALS. She earned her Master of Science degree in genetic counseling at Northwestern University in 2011 and resides in Springfield, Illinois with her family. Joining us as well is Dr. Danielle Geraldi-Samara, and if I mispronounced that, please forgive me, is a neurologist who has diagnosed and treated ALS patients since her fellowship at the Mount Sinai School of Medicine in 2007. She helped to develop an ALS neuromuscular clinic at NYU starting in 2014, and she has also had the privilege of serving as supervising neuromuscular specialist at the multidisciplinary ALS clinic of Northwell Health in New York. And lastly, Dr. Eric Anderson is an innovative physician scientist that has been recognized as a national leader in telemedicine and mobile health. He trailblazed the use of mobile telemedicine in emergency neurology and was the first to demonstrate and publish that the remote stroke assessment could be performed with an iPhone. His academic work has been published in high-impact medical journals and authoritative texts in neuroelectrophysiology, neurovirology, neuropathology, proteomics, telemedicine, and mobile health. And with that being said, I would like to welcome our guests for the evening.
Thank you so much, James, and thank you to our host speakers. We are so excited to have you talk today, but I just wanted to go over one thing really quickly before you guys dive into your exciting talk today. Like James said earlier, we really want to get you guys recruited into our speech study, and I know he hinted on it a bit. Even if there's a progression in your speech or a slur, that's the data that our scientists are asking for. And so we've changed the diagram to be a little bit easier for you guys to participate. And so we really want you to get signed on. So I'd love for you to, James, do you mind sharing your screen with the Everything ALS website? I don't have host privileges right now. I think you're on mute, James.
There we go, and shared.
Perfect. So if you guys all know, you're familiar with our website, everythingals.org. All you need to do is click on the research tab. There you go. Perfect. And then from here, we want you to put in your information. So scroll down just a little bit. And right here, you can just put your basic information in. We will have someone personally reach out to you regarding the speech study and do a one-on-one onboarding just to make it really easy for you. Additionally, if you're interested, please go ahead and just drop us your name, your email, and your phone number, and we will have Grace or James reach out to you individually so that we can help you through this process. And you won't even need to go online if you don't want to. Just let us know that you're interested, and we're happy to help with all of that. And one last thing I wanted to say is that we appreciate everyone that is currently in our speech study, and we are so grateful and appreciative of everything that you guys are giving in this. And I know sometimes it can be a little bit burdensome. We are working on reminder emails to be a little bit more flashy. I know Johnny, you just asked about that in the chat, and we will be sending out reminder emails on a monthly basis since we are asking you to do monthly sessions from here on out. Great. So thank you, James, for showing that. Go ahead and hop on our chat if you're interested, and guest speakers, we're happy to hear you.
Excellent. Thank you again for having us. I will let you know that on behalf of Brian Wallach, he wishes he could be here, but was unable to make it tonight. Things come up at the last minute. You know, it's life. But we do appreciate you all having us here. And he sends his warmest regards. I wanted to spend some time letting everyone know how appreciative we are of having this time to talk to you about Synapticure, which is the brainchild of Brian Wallach and Sandra, and the purpose of it is to form relationships with people afflicted with ALS, as well as other neurodegenerative diseases, and to help them along their care journey and offer them things and fight for them in ways that is typically not seen in standard arrangements. So without further ado, if now is a good time, we'd like to go ahead and start into our presentations. And I apologize for myself too. I have come down with a small cold, so I'm doing my best to keep my voice on the level. So bear with me. All right, so with that, I'd like to introduce, so I currently serve as the VP of Clinical Operations and Care Delivery at Synapticure. So the medical team, the care coordinators, the RNs, licensed clinical social workers, MAs, genetic counselors are all working with us here together in this aligned mission. And so I'd like to introduce Dr. Geraldi-Samara, who is our Chief of Neuromuscular Service Line Division, and will be presenting on Synapticure in a little bit more specificity for y'all. And Danielle, would you mind introducing yourself just a little bit more? I know you already had a little intro, but just give some people a little bit more flavor about who you are, where you come from.
Sure. First, I just want to make sure that you could hear me and see me okay.
Yes.
Loud and clear.
Okay, excellent. So good evening, everyone. Thanks for having me. My name is Danielle Samara, and as Eric said, I am the Neuromuscular Service Line Director at Synapticure. I'm a neurologist and a neuromuscular specialist, and I have been treating neuromuscular disease, including ALS, for about 15 years now. And I also started 2 community ALS clinics in my local area here in New York. And I did that from the bottom up, and I did it because I recognized a huge void in access to care in a population where it's much needed. And so this is why it's really my privilege to work with Synapticure, because it is really the continuation of my mission, but on a teleneurology platform now, which is super exciting. So just a little bit about me. And I am going to share now. I apologize. Okay, I am going just to, it is not allowing my screen share for.
Oh, do we have host privileges? Are we able to share
You
screens?
should be, yes.
Okay.
So if I go to share here, it's asking me to go to security and privacy to grant access.
Yeah, I think it's your computer access.
Okay.
So,
What I can do, Danielle, is I could share the presentation possibly. And then if you want to talk through it and just tell me when to flip the slides, I can do that too. Would that work?
Yeah. Thank you, Eric.
No problem. All right. So just give me a moment here. Again, I appreciate everyone coming out to listen to us. And once we get over this slight technical hurdle, we will be live and ready to roll. Okay. Danielle, can you just send that to me one more time real quick, just so it's at the top of my list?
Hi, guys. While they are figuring out their technical stuff, I wanted to let you know that a little bit more on the speech study. So I know I've been typing furiously on the chat, but if you've completed your 1 year of speech, we are still interested in your data. And I know it can be burdensome and maybe some of you wanted to reach that year mark and say, I'm done with Tina and Bamboo and Pataka. But I will tell you that our scientists are learning so much from your data. They are just so thrilled every time they can talk about things that I'm maybe not the best person to talk about, but the ratio of your lip distances and what they're finding, because they're getting so close to these digital biomarkers. So with that being said, if you're able to continue with the speech study and contribute your voice every month, we would love that. Please contribute more. We are happy to. If you have questions or concerns, then reach out to one of us and we will handhold, buddy system you up, and happy to talk to you on more of a personal level. But I know our guests just got their presentation up. So I will get back to the chat room and I'll see you guys soon.
Okay, great. Again, apologies for that, but we have it up now, so good. All right, Eric. So yeah, I'm going to move to the next slide.
Yep.
Okay, it just needs to go into slideshow.
Yep. Just 1 second, sorry.
Sure. Okay, so I'll start here. So this is a busy slide, and I just want to break it down a little first. So first off, this slide takes a look at several barriers and limitations that exist in the status quo of ALS care. So breakdown of those barriers is really one of the main missions of Synapticure. So first off, right from the start, we have enormous barriers just on the way to diagnosis alone. And that includes at the forefront excessive wait times, even to get into a clinic or an ALS center or to see a neurologist. So we at Synapticure can work with you and our partners and our affiliates on the ground to help expedite those initial visits. And we see patients not only with a diagnosis of definite ALS, but also with possible and probable ALS diagnoses as well. And just as of last week, we opened our doors to the care of primary lateral sclerosis, or PLS. And so once we pass that initial barrier, we continue to support you in the continuity of your care. And after that, you may continue, as you know, to face limitations, limited access to specialists, genetic counseling, and clinical trials. And I will speak to the latter in a bit, and Brooke will speak to the genetic counseling after me as well. And so additionally, I just want to touch on this. The frequency of care at your current ALS center or clinic may not meet your needs, or traveling to the office may be hampered by trouble with mobility, for example. So teleneurology really provides increased access and augments care for ALS patients. Okay. Next one. Okay. So what is Synapticure and what is CareND? So Synapticure is our organization, and CareND is the clinical arm to that organization. And so CareND consists of a full clinical team comprised of care coordinators who are RNs or licensed social workers, genetic counselors, and teleneurologists. And we offer, as we'll talk about in a little bit, genetic and molecular testing. We have partnerships with the top ALS academic medical centers, and we have a personal care portal built for patients and caregivers to centralize all their medical records and to track care throughout the disease course. And we work in a way that we can send referrals to ALS clinics or centers of excellence for all those of you who wish to be plugged into them, but who may not have access. And we also work by bridging gaps in care and by magnifying care that you already may have. And we realize that it is a very common concern that people have. Am I allowed to have two neurologists? Is that okay? Especially when you have one that you may already have a good relationship with and like very much. And there may be issues, as to whether that may hurt a good relationship that you have with this neurologist. And that is a perfectly valid concern. And speaking broadly, most doctors are very used to multiple physicians involved in patient care, including those who give second opinions. And for the most part, there's no offense taken by this. But rest assured that when we work with you, we want to maintain open communication with your neurologist. We don't look to replace them. And because we view it as such, we, again, keep that line of communication open and share with them as much or as little as you want. The bottom line is, however, that if you don't wish to share your visits with us with them, then rest assured that they will not be shared. So this is, when you see us, it's your private health information of which you have full ownership, and the only way we would share it is with your permission. Okay, next. Okay, so this is really exciting. So right now we are live in 44 states. As of this afternoon, it was 43, and we just added one late in the afternoon. And our plan is to be live in all 50 states by the year's end, with the cooperation of those remaining 6 medical boards. And some have licensure processes that are lengthy and longer than others. But we are confident that this is a realistic goal that we'll achieve by 2023. Next one. So right now we have patients signed up over, as you see, over 670 from 47 states, and we are growing by the day. Okay, so many of our patients have not been seen by an ALS specialist, but still may be eligible for clinical trials. And here's another way that we can really intervene and expedite enrollment if eligible. So for example, you may not think that you have a familial variant of ALS, but you haven't had any genetic testing, let's say. If you follow with us and follow with our genetic counselors and have the genetic testing, you might come to find that you have one, for example. And just realize that there are trials out there that are specific to certain variants and mutations. And these are trials that you might actually be eligible for if you were to have a complete genetic panel performed. So basically, in a nutshell, we want you to have that full knowledge that these things exist for you, if they do. We want all the options on the table for you. Things change very quickly in the world of research, particularly in the worlds of genetic research. And we want you to be at the forefront there, and we'll keep you up to date on all advances in testing and trials and treatments. So just, some of our stats here, 24% of patients have never seen an ALS specialist. 43% have never been to an ALS clinic with access to therapeutic trials. And 50% reach out to us once they're eligible for those trials. Thank you. Okay, so we'll go through a bit of a flow chart here. So we have patients from all different situations. And when I say that, I mean patients that are coming from small local clinics, patients that are coming from large academic medical centers, patients that are coming from MDA clinics, also patients that are coming from solo neurologists in private practice, and patients who may not have neurologists at all and may be managed by their primary doctor. And we welcome all of you. So this is a flow diagram of how we work. So first you would register and with Synapticure, and then have a meeting with one of our care coordinators, one of the nurses or social workers. And that care coordinator will take a very detailed history and then work with you to compile all of your records from your different physicians and therapists, and to assemble them into one place that's accessible to you and to anyone or any physician that you wish us to share it with. If you have a physician, then we will co-manage with that physician. We can provide interim visits at higher frequency. So let's say more frequent than quarterly. Many ALS clinics will want to see patients every 3 to 4 months. But if you feel that you need to increase that frequency, we can help you with that, and with very, very little wait time. Going to the genetic counseling. If you want or need genetic counseling, Brooke and her amazing expertise will take the reins from here. I won't speak any further on that, and I'll leave that for her. So we also provide implementation of local referrals to different therapies, for example, speech, occupational, physical therapy, respiratory therapy, especially if you start at an ALS center that is distant from your home. So as you know, this is not an uncommon situation. We have, superb centers throughout the country, centers of excellence, but the one that you choose may not be in close proximity to your home, and you had to travel for the initial diagnosis and care plan. And that's great. But obviously it's not feasible to continue to go back and forth for your treatment. So we can help you arrange home health care, home health services, or services that are just closer to you and local to you. We also work with you in terms of prescription. So in, treatment in terms of therapy, but also treatment with prescriptions. And we work with both types of treatment. And when I say both types, I mean the disease modifying medications as well as symptomatic treatment. So our disease modifiers, as the name says, those that actually work to modify the progression of the disease, and this disease to slow the progression. And you all know the three that we have in the toolkit: riluzole, Radicava, and Relyvrio, our latest addition. And we can prescribe those medications for you, and we can deal with whatever comes after. So whether you need a prior authorization, whether there's a denial and you need a physician to do a peer-to-peer or an appeal, we're there for that. Then moving towards the symptomatic treatment, and those are things that treat symptoms and help enhance your quality of life. For example, prescribing a muscle relaxant if you have pain from spasticity or spasms, or prescribing a medication to help dry you out if you're experiencing increased saliva production or hypersalivation, things like this. So we're there for that too, and fully capable of providing that for you. Education. So we offer education in a number of ways. One way is in going through nutraceuticals and supplements. A lot of times there isn't enough time at a face-to-face clinic visit to hash through all of this stuff. And we know that many, if not most of you, are taking supplements and nutraceuticals, and that is great. But what we want to do is really hash it out. So we go through a risk-benefit analysis of your nutraceuticals, your supplements, along with whatever medications you're taking. And we like to do this first through a scientific lens. So first we look at, a given supplement and look at the data that supports it, or the data behind it. And then we look to see, are there any risks to it? So something might be okay in small dosages, but if you were to take it in mega dosing, then it might have the potential to create some toxicity or some adverse interaction with another medication or supplement. So we look at the big picture, and then you, with one of the neurologists, come to a well-informed and well-educated decision together and make a care plan for your pharmacotherapy, for your medication. Another arm of education is with respect to clinical trials. And we are here to assist in enrollment when one is eligible and wishes to participate. So many times in ALS centers or academic medical centers, it is very seamless to enroll, if you're eligible, into their trial. But the issue comes when there are maybe other trials, and there are many throughout the country that you might be interested in. They might not be able to give you the time you need to go through all of them, to look at eligibility and to see which one you might prefer enrolling in, because there may be more than one. And we take the time to help educate you, as to what's going on in the trial, and to your eligibility, and if you're not eligible, as to why you're not eligible. And then finally, we also offer remote patient monitoring, or RPM. So currently, we have a respiratory RPM pilot program in place. And in this program, we are sending FVC, so forced vital capacity devices, to patients in their homes. A respiratory therapist is involved to show the patient how to use the device properly. And the data that's obtained from this device is actually shared remotely with the respiratory therapist and with the Synapticure neurologist. And this is awesome because the goal is to really gather information and gather data and to see if it's actionable, to see if maybe we, if by gathering this data, we can intervene on something earlier than we normally would have been. And also, we are also alerted in this program to any sudden changes, anything acute that you might not expect in the disease course of ALS. So any sudden or sharp fall in the vital capacity, which might suggest something else going on, like pneumonia. If that happens, then our doctors are immediately alerted to it, and we will touch base with you and then act accordingly with regard to any intervention that we think is necessary. And then on the roadmap, we also plan to implement remote patient monitoring with weight loss. So basically sending scales to patients, looking at weight loss in order to monitor good nutrition. And as you know, good nutrition is paramount to maintaining your strength and keeping you as stable as we can for as long as we can. Okay. All right, so again, I'll reiterate this and I'll reiterate it again and again, because this is really the core of who we are at Synapticure and something that I feel very strongly and passionately about. We are patient-focused, we are patient-centric, and we move forward as an organization as such. So from a survey of our patients, we've identified needs and we act on those patients' needs. And by no means is this an exhaustive list, but we'll look at them, so the need for home health care and home health aid, that rises to the top. There's a need for insurance navigation, a need for legal support, which is on our roadmap, use of biomarkers as prognostic tools, which we have, psychotherapy and grief counseling also on the horizon. The implementation of the therapies, speech language pathology, physical therapy, occupational therapy, respiratory therapy, local to you, but with our goal of having some of these services eventually in-house with Synapticure and available on a tele platform. And again, the remote monitoring program, with the hope that this allows us to intervene earlier on certain things, and also to obviate the need for increased frequency of face-to-face visits, which, as you all know, can be cumbersome. Okay. Okay, so this slide here is just another map of where we're headed. So on this slide, what you see in the darker blue or purple is what we have live now and what we have implemented to date. And then what you see in the light purple are things that are in progress. And then in the light gray are things that are on the horizon. Most of these things, I've gone over already. And so along this journey, we will stand by you and navigate with you every step on the journey, okay? Whether it is seeing us with increased frequency to address any interim concerns, whether it be to refer you to receive services for a newly identified need that pops up in between visits, let's say, or whether it be to prescribe a medication for a symptom that just developed and you really don't want to wait for that visit to your clinic, we will be glad to take care of those needs expeditiously. So basically, we don't just see you once and then drop it from there. We navigate with you and we advocate for you the whole way. Okay, so last slide, and at the end of the day, so our goal, our mission, what's at our heart is to deliver precision medicine high quality care via a teleneurology platform that is tailored to you and only you. Okay, and we want to put your voice at the forefront of your care as it absolutely should be, and to allow you the access of the full gamut of care, whether that be medication or trials or therapy, because that is what you deserve, and frankly, that is your right. And again, we will advocate for you through the whole journey. So we can be one facet in your multifaceted care that you already have, or we can be the initial force that sets your care plan in motion. So with that, we hear you, we see you, and we feel you, and we thank you for this opportunity to speak with you this evening. And I will turn it over to Brooke.
Hi, everyone. I know there were some questions in the chat, and I think we will at the end try to go over those so that everyone can hear the answers. I was typing some answers as we were going, but we will have a discussion at the end. I'm not sure if anyone has any questions that we can just hold off and do those after my presentation, or do you guys typically want to do any questions right after the first presenter?
So what we'll do is, as soon as everyone's done presenting, we'll ask the questions, and whoever can answer them will do it. And I know you were excellently answering them in the chat, but just in case people aren't able to come to these meetings, we have them on YouTube. I may ask some repeats. So just we're looking forward to the presentation.
Great. Well, I will start. I did not create a poll in Zoom, but I would just like to ask that anyone that has heard of genetic testing in the ALS world or possibly pursued it themselves, if you feel like raising your hand or putting a signal up or a reaction on your screen. Good to see you guys, and just was curious kind of how many were coming to this presentation with an interest in that realm. I will be speaking from my position as genetic counselor, sort of walking you through what it would look like if you were to sign up for Synapticure, how it would work on our website, and then what the process would be for anyone that does proceed. I have done a previous presentation that goes into the details of genetic testing. I'm not going to go into great details about each gene or anything today, but I will give a couple of case examples that I think will be useful. So I will go ahead and get my presentation going here. Let me pull up the share screen. Hopefully we don't have any technical issues. Okay. So again, my name is Brooke, and I'm here to talk about what the traditional model is and how we at Synapticure are hoping to change the traditional model of medicine. These are my kids at a clinic, and it just kind of highlights here some of the difficulties with being in person and why we think that maybe being seen from your home is a better option. So those are my kiddos in a regular clinic, and I would propose that it is sometimes much more beneficial to be seen from your own home. You can have participants on the call with you to listen in to what either a physician or genetic counselor is saying. You can, do it from an iPad or from a computer. And in terms of genetic testing, we are also able to do that process from home as well. So our model is definitely providing access from where you are. This is a picture of our intro page. If you were to go to my.synapticure.com, you can click Get Started, and you will come to this form, which will request a few questions of you if you're interested in signing up. This will not start by billing your insurance or anything like this. This just gets you connected with an individual called a care coordinator who would speak with you about what your needs are, what your desires are, and how we can help you. And then from there, as Dr. Samara went through, there are many different options for the care services that we provide. Okay, here's a picture of some of our care coordinators. We recently met up as a team in Chicago, and there are a great group of individuals that help basically be the frontline person to speak with you after you sign up on our website. Many of them have a personal connection with ALS, have lost family members to ALS, or are living with family members that have ALS. So I think we have a very good personal touch from that aspect. And they all are very experienced, ranging from working as hospice nurses to social workers, and we just have a great team. This is me. This is where I come in. So if you do opt for genetic counseling, one of the big pieces of that conversation is usually talking about your family history. So if you've had genetic counseling, you might be familiar with this picture. This is what our family tree, drawing it out, looks like. Typically, the squares are males, circles are females. And the conversation would be discussing whether you yourself, with a personal history of ALS, do have a family member with ALS or potentially another neurodegenerative disorder that might be linked. We do know that individuals with ALS, even in the absence of family history, have about a 10% chance to have a genetic cause of that. So that's why we feel like it is important, even that in the absence of family history or knowing about someone else in your family with the condition, to at least be offered the option of genetic counseling and testing. This is a nice picture that goes to show that there are a lot of links between different neurodegenerative disorders. So when we talk about that family history, this is where it plays a role. Some of these other disorders may be noted in the family, and that might help determine what testing is best for you and your family. So in terms of genetic testing, it's fairly standard for an individual with ALS to be, if they're offered genetic testing, this does sometimes happen in your routine clinic visits, but because the conversation can be fairly long, it's not always something that every individual has a set time to discuss in detail what testing options are available and what results might mean. Generally at Synapticure, we do start by offering at a minimum some of those sponsored tests, which I know some of the conversation in the chat was started regarding those. And there are several options available. We do try to make sure that individuals have access to testing, which would, definitely link you with the trial that's available. So there are some genes that are on certain panels and not on others. And so we just try to make sure you're aware of what we would be looking at and what the benefits would be of testing one panel versus the other. Things are ever changing in terms of the number of genes on these panels. However, there are still usually 3 types of results that we can get from testing. 2 are fairly obvious, positive or negative. We either find something, we don't find anything, but there is a 3rd category called a variant of uncertain significance. And when we find this, sometimes we do talk with family members if that's an option, talk with other individuals that are not related to you, but maybe have the same variant, and kind of learn more about the meaning of that. So genetics can be complicated sometimes, and it's nice to have someone to discuss your results with if they're not as straightforward. So if an individual does choose to proceed with the testing after they've spoken with me, or if you talk with your provider and they order this testing for you, typically if you don't get blood drawn in a clinic, for instance, in our situation, we would mail a kit directly to you, and that would come from the laboratory. This is a picture of a saliva sample collection kit. So the very top is open so that you can submit your saliva into that tube. Once it reaches a certain level on the line, you close the top up. That inserts some liquid into the tube, and then you basically have a lid, and you would put it back into the packaging that would come with your kit. So you would return your saliva sample into a box and then put it into a FedEx bag, and that goes directly back to the lab. So this is something that can be done simply from your home. And usually after you send that FedEx bag back to the lab, it takes about a month to get results back. So here I have provided just an example kind of sample results so you have an idea of what that looks like. If testing is negative, it's pretty generic, just says we did not identify a cause in the family. And again, that is ever changing in terms of what we can test for. So even individuals who may have had a negative test in the past, even if your testing was 2 years ago, there may be some genes that were not screened for on the prior testing that you could benefit from looking into additional testing. So we do recommend following up with your team, even if with a negative result in the past. I'm going to go into an example of a positive result. This is specific to one of the genes I mentioned in the chat. So this is a gene that previously was only thought to be associated with a condition called SCA, or spinocerebellar ataxia. But as studies went on, they realized that certain individuals with a change in this gene are at a predisposed risk about 3 times higher than the general population for ALS. There is a specific trial available. So this is one that we do encourage individuals, if they haven't had screening for before, to consider, because this is part of one of the sponsored panels. So when we do have individuals come back with this positive result, it helps guide them to a specific management recommendation, which is considering, the specific trial. So that's just one kind of example of how genetic testing could change your management. For familial testing, I did see that Mindy Erlob is on this call, and I would have been very grateful. She wrote a wonderful piece that is on the I AM ALS website, and it just discusses how do you talk with family members about genetic testing, particularly if you have had testing and have been identified to be a carrier. So, we do encourage having conversation with family members and help you kind of walk you through that. There are a lot of things that our team can help with. It's not something that you should kind of face alone and trying to figure out how to converse with family about genetic testing. So there are some great resources that we try to provide families with, and definitely some great support groups out there as well, should you end up with a positive result and want those types of support groups. We at Synapticure have recently not only just started seeing patients with ALS and PLS, but we also are open to seeing families where there is a predisposition. We know that times are changing, and the hope is that pre-symptomatic individuals may be able to access treatments that would prevent progression of the condition. So at this time, if that is something that, there is a family that's interested and maybe hasn't had testing, we're happy to walk the family through what the different options are, research testing versus clinical testing, versus just thinking about testing and knowing that that might be an option in the future. So that is a piece that we, definitely want to help with if anyone needs that. So that is just a brief overview of what it is like to go through genetic counseling at Synapticure. This is a picture of our full team, and my contact information is on this slide. So my email address, if you would like to email or call or text, that's my phone number as well. So I think I'll leave some time, hopefully, for a few questions now, and stop sharing my screen.
That's amazing. I just want to make sure, do we have any other presentations before I kick off the Q&A?
No, this will be a great time to questions. Thank you.
That's amazing. I have to say there was a lot of information there, and we were getting a lot of questions in the chat, so I don't want to waste any time. I'm James, and our student ambassador Lily will also be helping to field some questions. I'm going to kick it off with, can family members of ALS patients also get genetic testing through Synapticure? And if so, is there a cost?
Can you say again, who would get genetic testing? I'm sorry.
That's okay.
The first part of the question.
That's all right. Can family members of ALS patients also get genetic testing?
Yes, that is something that we are enrolling patients that on our website, it says either I have ALS or I am a caregiver. So that's a bit confusing for some people, but really, as long as you just select any option and explain your situation, we're happy to help on the back end to do that.
All right. Hi, everyone. I'm Lily. I'm just going to continue off with the questions. And I know, Brooke, you sort of answered this in the chat, but maybe you could just repeat again. So just to elaborate, is Synapticure a care service like an ALS online clinic?
I'm happy to answer that too.
Yeah, I kind of answered it in the chat, Eric, but I don't know if you could see that now.
Yeah, so Synapticure is built to work hand in hand with some local services. We do provide a lot of services that are not able to be, for folks who aren't able to get to a clinic or aren't able to get to a center, and we're expanding those services as time goes on. So we're bringing on things like speech therapy and physical therapy and those kinds of things that can be done, the portions that can be done online. And as far as assessing patients, especially those who already have a confirmed diagnosis. Now, as was mentioned before, we are taking people who might have a diagnosis wherever you are in the stage of your ALS journey. We're able to help direct you, expedite workup if you haven't gotten it yet. And for those who have a confirmed diagnosis, we open up a lot of other services for you that we can provide. So yes, I would say that we are in a sense, a virtual portion of an ALS clinic, but right now we are not a one-stop shop.
Well, that perfectly segues into the next question. Does Synapticure services also work if one ends up going into hospice as well?
So yes,
Go ahead.
So our services do not conflict with hospice care. And that is a very valid concern that does come up. You know, if I'm in hospice, is enrolling with Synapticure going to jeopardize that? And, you know, and the answer is no. We would work hand in hand with the hospice nurse or the hospice physician to provide seamless care there. But yeah, it's not something that would be, if the question is it something that is, you know, contraindicated for a hospice patient? No, the answer is no.
Yeah, and just to ask and add on a little bit to that, do you work and provide any services to VA clinics as well?
I was going to just mention that we did just put out a blog post today. If I don't know if we can share a link somehow with this group or if I should put it in the chat. But we are working to be in network with many providers. And so the best option is, if whatever your provider is, whether it's VA, private insurance, if you are interested at all, signing up for our website helps us to be able to work with those different providers to try to go and network with them. So I will try to post the link for this here, but I'm not sure if Dr. Anderson or Dr. Geraldi-Samara would like to say more too.
Yeah, so the question, I think, you know, is do we provide, we don't provide services within the VA system, of course, but we can work hand in hand with folks who do see people at the VA. The questions around insurance, TRICARE, those types of things are things that we are continuously navigating. So we have insurance counselors on board, and insurance navigators that can help us figure out, you know, the best solution that works for you. So I wouldn't let that stop you from reaching out.
And Brooke, thank you for putting that link in the chat there. And for those of you who are watching, synapticure.com, and that's how you can navigate to the blog post. And Dr. Anderson, I know you just spoke about this in terms of wherever one is in their journey for ALS. So does Synapticure also help with people who may be pre-diagnosed or even pre-symptomatic with ALS?
Yeah, so that kind of ties in nicely with a previous question, which was, you know, do we do genetic testing on family members? So certainly amongst our patients at Synapticure, when we've identified someone who has a genetic variant, you know, we typically offer familial testing for those patients, and they see Brooke. And if we find patients who are, you know, children or family members who, you know, have a family member with that disease, and we identify a pathologic variant in those patients, we do offer them to come in and see us. They may not meet criteria to be seen in a local clinic or anything like that. They may be pre-symptomatic, and they can come in and see us, and we can try to guide them on the right steps to move forward. So yes,
That's great.
we do see pre-symptomatic patients.
That's great. Thank you. So for our next question, can Synapticure help patients get insurance companies to cover certain treatments?
So what I will say is that we do have on board a full-time insurance navigator who works with patients to address those specific issues involving unlocking benefits, trying to figure out how they can get coverage for certain things. We propose one-off agreements with insurance companies when they're trying not to cover. Well, we will go to whatever lengths we need to go to try to help. But yes, we do have specific people who can help with that.
That's fantastic. I know that often is a gigantic hurdle for almost everybody involved with ALS. Speaking of which, in what capacity do your services apply to international patients as well?
Unfortunately, this is something that we continually get requests about. Just recently, we've had requests from South America, from Europe, and other regions asking to see if we can help them. The difficult part with that is that legally we can only practice medicine or care for people in places where we are licensed. Without having any type of agreement or licensure in another country, it's especially where they're required, it's a difficult situation. So we hope to, in the grander scheme of things, to be able to venture out into that area, but as it currently stands, we just we don't have the licensure or the agreements in place to see people in another country legally.
Yeah, and just to delve in a little bit more into your services, do you provide patient lift scales or other scales that can be used for people that are immobile?
Right. So that was mentioned in Dr. Geraldi-Samara's presentation, that our remote patient monitoring suite is extending to weight, fall detection. There's a list of other things that we are branching out into, but certainly weight scales is one of those things. Right now the current model is primarily for people who can get onto the scale. We are looking at options that would be possible for folks who don't have that same ability. But right now it's a limitation of the technology, which we hope to, find a way to overcome.
I know you just spoke about how you're only licensed to practice in the United States, so this question is very apt for that. Is Synapticure able to prescribe or help get prescriptions for any prophylactic medications like riluzole to pre-symptomatic genetic carriers of Sinai Orf72?
Yeah. So, this is a complicated question. What I will say is that what we are able to do for patients runs the gamut of requests, and we have, in our experience, been able to facilitate patients getting various medications from overseas with other things in place, as well as navigating different nutraceuticals, off-label medication uses, and things like that. All of these things, of course, need to be done in conversation with a physician, make sure that there's no after effects or side effects, potential mal effects or interactions with other medications. But all of these things are things that we do and have taken on. So my answer to you would be that is a great question to have with a Synapticure physician, and I will say that is something that we have certainly have experience with.
Gotcha. Thank you for that. And I know you had a slide on this earlier, but do you mind just explaining DNA banking a little further and how it's utilized? And also, is that done with whole genome sequencing?
Sure. So DNA banking is a great option for families who maybe are unsure if the person with ALS is interested in actually having genetic testing, or maybe they've had some genetic testing, but haven't had a very comprehensive test and want to have their sample available so that maybe in a couple of years, if there's a new gene discovery, that sample would be available for family members. So that is an option some people do choose for a variety of reasons. Typically cost is maybe somewhere between $100 and $200, depending on who you do it through. So we have helped some families in the situation where they really want to be able to do testing, but aren't ready to do it at that moment. That's a little bit of a separate question from, do we do whole genome sequencing? We work as clinicians to provide options of genetic testing for families, patients with ALS. So we, as a standard, can offer anyone testing based on family history and personal diagnosis. However, I would say that it's not a standard to have everyone have whole genome sequencing because the cost is fairly high and Medicare does not cover that. So will there be some patients that will proceed through a research study and or through self-pay with whole genome sequencing? Yes. But is it a standard that is covered for everyone at this point in time? No. It is a conversation we can have and would happily talk to anyone about that. Everyone's situation is a little bit different.
Boy, you're hitting the nail right on the head with these questions. I know we want to be respectful of your time, so I'm going to make this the last question. In regards to the genome sequencing, I know you just answered that you don't do the full one. So for the ones that you do, how much are, for an estimate, cost-wise is it? And is there any option to have it funded or covered by insurance companies as well?
Sure. So I will say that there are sponsored testing panels. So that's what a lot of people speak about when they say I've had genetic testing based on ALS diagnosis. And those are genes that are specifically identified to know to increase your risk for ALS. So that's a starting point for some individuals. Right now, at this moment in time, there are sponsored options where that means you do not pay, it's not billed through your insurance. There's a third party paying for that because they gain de-identified genetic data by that participation. And so they pay for the de-identified data, you get your test results, and that's sort of how that piece works. So for some families, they are fine with that and they move forward with the sponsored testing. Other families might choose to just pay for the testing. They don't want to, think about that data piece, so they just pay for it themselves. And then beyond that, anyone that's interested in further testing, or maybe there's a different indication, not just ALS in the family, but there's a lot of FTD dementia genes that may be relevant for family members. So that is something that we may order a separate panel. I would say panels generally are in a couple $100 range if you do self-pay. But then something like whole genome sequencing is more in the couple $1,000 range. And again, it's very specific to your insurance, but we would walk you through all of those pieces specific to you. Some people do use certain funding from maybe ALS Association. We've seen people use that money to pay for genetic testing. There may be some other resources we could provide you with as well.
Absolutely incredible. I think the services you all are providing are critical and just amazing to everyone. I just want to thank you for that and for joining us tonight as well. You are more than welcome to join us for our next session. And we turn off our recording session and we have an open forum where anybody and everyone can speak. But we understand you're very, very busy as well. So if you have to leave us, that's all right as well. We just wanted to thank you again. And I'm going to turn it back over to McFinn.
Thank you. Thank you, folks. I always say, look what just came to our living room. The people who presented tonight, how many years of experience have you put together and brought to us as a gift? So I just want to say, wow, we are in the right place at the right time for the best of all concerned.